My name is Amanda McCarthy. I'm the Director of Social Determinants of Health at Advanced Health, a Medicaid CCO organization serving Coos and Curry counties on the southern Oregon coast. I have worked with MedInsight for 3 years, and before that, Milliman PRM for about another 7. Advanced Health is a Medicaid coordinated care organization. We are in charge of coordinating physical health, behavioral health, oral health, substance use disorder treatment, transportation for our members. We are unique because we are locally owned and operated. We live, work, play, and age in the communities that we serve, and that makes us very much in tune with the needs and wants of our population. Advanced Health has a mission to improve health outcomes for its members, and one of the ways we do that is through monitoring population health. And these often take the form of metrics. And in order to really understand metrics performance, we have to understand where we've come from and where we're going to, and we do that with data. And historically, data has been claims-based. A provider sees a member, they submit a claim, there's a diagnosis on that claim, there's CPT codes to really describe what service was offered. With the introduction of electronic health records, we really understood that there is so much more data that is captured in the process that is not reflected in claims. And the state of Oregon, who really sets these measures every year and is in charge of really monitoring and providing oversight for performance for each individual coordinated care organization throughout the state, they started to really look at what it would be like to add that clinical data into these measures. And so we have a number of incentive measures, we call them, they're population health measures, that leverage that clinical data. Advanced Health is required to submit data on these clinical metrics. And how we do that is in the simplest form, really. We have to submit them this spreadsheet, and it provides numerator, denominator, exceptions, exclusions, and rate by clinic and as a whole. And without the process that we've built with MedInsight, we wouldn't be able to do that. And so it might seem like a very rudimentary success story to tell, but honestly, we couldn't participate in this process without this collaboration and this output. And so we navigated in 2021 an EHR conversion that was community-wide. And this was an effort on behalf of our community partners and our stakeholders to say we want continuity for our patients. If they go to the hospital, we want to know about it. We want to have access to those notes. So they banded together and they went in for an instance of Epic. So the conversion was stressful, to say the least. If anybody's ever done it, they completely understand. But what also was a side effect was a change in file formats, a change in data headings, and it really created a lot of issues in the consumption of data on MedInsight's part. And this, of course, happened unbeknownst to most of us because it was stable for a short period of time and then it changed again. And it was the success of this comes from that collaborative relationship where we were able to sit down and understand why things were very chaotic and what needed to happen in order to fix that, to bring us back to a place of stability when it came to data files and reliable data, and understanding how we could do it better and keep that process stable in the future. So the Oregon Health Authority requires CCOs to participate in these clinical measures in order to get any of the quality pool dollars that are allocated for that CCO. And the ability that we have to participate because of our collaboration with MedInsight, gathering that data, putting it through the logic, coming out with an output that we can use, keeps us in a place where we can earn that money, not only for the CCO, but then later for the provider network. Those dollars that are earned through these metrics are distributed directly to providers who do the work. And so what it does, in addition, is it really keeps that cohesive relationship between the providers and their coordinated care organization that they buy into and they support and they align with the mission of. And it's just one extra thing we can offer them as providers in our network. Advance Health's partnership with MedInsight has helped address community goals in the fact that the community wishes for better health outcomes and a healthier population. When we think about what that looks like, we often think about early detection. When we can look at data and identify trends, when we can identify health disparities for accessing preventive medicine or seeking regular care, then we can further build interventions to address those. And that has an impact on overall health outcomes for the population as a whole. We find that early detection leads to early intervention that is meaningful.